Hi, my name is Christina Lewis, and this is my demonstration speech. And today I will be demonstrating how to take a set of vital signs. Vital signs are very important. They help doctors and nurses diagnose and treat multiple diseases, and it's always good for everyone to know what their numbers are. Let me show the crowd. Okay, lots of things have changed as far as vital signs over the years. I've been a nurse for about 20 years and I've seen lots and lots of changes. Temperature, we used to use the old mercury thermometers and they would take about 5 minutes to get a temp, and that's just really difficult in some situations. And then we've moved on to the electronic thermometers. You can take it by the ear or the mouth. Now we have these temporal thermometers and those work really well. Pulse, the old way to take the pulses was to use a stethoscope and listen to the heart for 60 seconds to get a good apical pulse. You can also take a pulse on the arm. It's radial, brachial, carotid, and then behind the knee is the popliteal. You can also take a pulse with this oximeter, and oximeters are used to not only take a heart rate, but also to check the level of oxygen in your blood, which is a pretty important number in most situations. Blood pressures, the old way to do it, of course, is with the old blood pressure cuff and stethoscope, and we have moved on from that to big machines that you find in hospitals and emergency rooms and surgeries, to just what a lot of people use now is these little wrist blood pressure cuffs. So we've come a long way checking for vital signs. So I need a volunteer from the audience, please.
Oh, you're not going to stick me with a needle?
No, nope, not going to do that. So this is my friend Terry, and I'm just going to show you how to take a set of vitals with Terry's assistance. With the temporal thermometers, it's real easy. You just turn the button on, start it here, move around to the tempo, and then you get the reading 98.2. So that was real simple. Heart rate, we're going to use a oximeter, and so we're going to find out Terry's heart rate as well as the oxygen level in his blood. So this just goes one finger, and you just wait for the numbers. And so you have heart rate of 91, and
Is that good?
that's good. Your oxygen level is 93. Take a deep breath. Let it out. And we jump right up to 95, which is a good number. Any number over 90% is good for your oximeter. What the oximeter shows, of course, the level of oxygen in your blood, which tells doctors and nurses how well your heart and your lungs are functioning. So people with chronic heart disease or lung problems, we keep a really close eye on that.
That's me.
Yes. Now we are going to check his blood pressure using this new kind of machine. You just put it around the wrist. Put this up here. Hold still. And hit the start button. And we'll check and see what Terry's blood pressure is. These machines are all really, really easy to use. It used to take 10 to 15 minutes to get a good set of vital signs, but through the years, there's been a lot of advances, and we can get these numbers much quicker and then therefore treat that much quicker. So, in blood pressure, there's always two numbers. People always say the top number and the bottom number. Those numbers are the systole and the diastole, and it tells you how much pressure literally is your heart has to pump. Terry's blood pressure is 122/71. That is a textbook number. That is a wonderful number. Anything over 140/80 would require probably a retake. So in conclusion, I've been a nurse for 20 years, and we've taken vital signs everywhere you go, and they're very, very important in the treatment and prevention of disease. Thank you.